but we cannot hear you.
Yes, sir. We'll start
Okay.
now.
Yeah, that's fine.
So my topic today is pain management. So first we'll see the content, introduction, classification, type, pain management, and treatment. So first we'll see the introduction. So what is pain management? Pain management is nothing but is implementation, sensory and emotional experience associated with the actual of the tissue damage. It is related to the patient who undergoing the treatments like cancer and our patient. It will be 70 to 90% the patient will be having the pain. So next point is classification. Classification, we have acute, chronic, non-malignant, and malignant. So first we'll see acute pain. Acute pain is nothing but is by many evident circumstance. It will affect, it related to the skin muscle, like injury, trauma, disease, or maybe the patient will be having the high blood pressure, tachycardia, and it's usually subsided quickly as pain reduced, stimulated, decrease. So next is chronic management. Chronic management, non-malignant. The pain is related to the treatment like chemotherapy, radiation, patient they will be having the bone pain, muscle pain. So we'll see next the type of pain. So type of pain, we have somatic, visceral, bone, neuropathic, emotional, and spiritual. So first we'll see the somatic pain. Somatic pain is nothing but the bone fracture like sharp muscle, connective tissue disease, such as arthrophoresis, cancer that affect the skin and bone, and joint pain also. So next we'll see the visceral pain. Visceral pain is the pain which affect to the internal organs such as gallbladder, intestine, kidney, damage of the muscle in the abdominal walls, acid indigestion, infection of the digestive and the renal system. So next we'll see to the bone pain. Bone pain is the achy or other discomfort in one or more bone. It is different from the muscle and the joint pain because it present whether you are moving or not. So neuropathic pain. Neuropathic pain is caused by the damage of the injury to the nerves that transfer information between to the brain and the spinal cord from the skin muscles and the other part of the body. The pain actually described in the burning sensation and affect area often sensitive to the touch. So next we'll see the classified by interfered pathophysiology. First one is nociceptive pain and neuropathic pain. So first we'll see the nociceptive pain. Nociceptive pain is stimulated from the somatic and the visible structure, and it is affect to the like the skin, deeper skeletal structures such as bone, muscle, and the visceral structure and the organs. The type is superficial somatic and deep somatic and the visceral. So next we'll see the neuropathic pain. Neuropathic pain is caused by the pressure and destruction of the peripheral autonomic of the central nervous system structure, radiation of the pain along the tomal or the peripheral nerve distribution, often describe the burning and the deep itching associated with the dysphagia and the lancinating pain. So next we'll see the effect of pain. The effect of pain, we have sympathetic response, failure, increase in the blood pressure, increased pulse, increased respiration, skeletal muscle tension, and dysphoresis, and the changes in appetite. And one more is effect of pain, dysphoresis response, decrease in blood pressure, decreased pulse, nausea, vomiting, weakness, pallor, loss of consciousness. So pain assessment, here we'll see the pain history. So before administer any analgesic, we need to ask for the patient the site of pain, whether the patient is having pain, type of pain, which kind of pain they have, especially relative factors, how frequent the pain is they having, impacts on the daily basis, and the other important question need to be asked. What is the response if the past, like we administer analgesic, whether it's helpful or not, all kind of data and record about the pain, fear they have about the analgesic. So pain assessment tools, we have verbal analog scale and visual analog scale and the face scale. So factors are considered at choosing a pain scale. So we need to ask the age of the patient, physical condition, level of consciousness, and mental status. The patient is ability to communicate. First, we'll see the numeric pain rating scale. So we'll ask the patient the rate of the pain intensity based on the scale 0 to 10. The worst pain is imaginable. Some patients are unable to do with the only verbal structure, but may be able to look at the number scale and point the number that describe in the intensity of the pain. So this is the numeric pain rating scale. So from the grade 1 to grade 10. So from the grade 1, like no pain is there. So from the grade 3 to grade 6, moderate pain. From the 7 to 10, the worst possible pain. So next pain scale, we'll see the Wong-Baker face pain rating scale. So this can be used for the young children, like above the 3 years old of age, and it's work well with the many older children and adults, as well for those who speak in different language. So explain each face present to the person. They have no pain, some pain, as much pain, imaginable, point of the appropriate scale that can be appropriate description. So this is a Wong-Baker face pain rating scale. So grade 1, point number 1 is no hurt. Number 2, hurt a little bit. Number 4 is hurt a little more. And number 6, hurt more, even more. And number 8 is hurt a whole lot. And number 10 is hurt worse. So goal of pain management therapy. The goals of pain management therapy is decrease the pain, decrease in the healthcare utilization, decrease in the emergency room visit, improve functional status, increase ability to perform activities of the daily living. So management, we have non-pharmacological treatment, analgesic, adjuvant, and others. So first we'll see the non-pharmacological intervention. So here it can be relief the patient, which can be able to manage without any medication. Like they will be having this exercise, weight reducing, counseling, massage, relaxation therapy, hot and cold application. The next is analgesic, non-opioid, opioid, and adjuvant. So first we'll see the non-opioid. The non-opioid is included the acetaminophen and the non-steroidal anti-inflammatory drug, NSAID, such as aspirin and paracetamol. The next is opioid. This is used to be called as narcotic. It is a substance used for the treatment moderate to severe pain, such as morphine and codeine. Adjuvant is commonly used to prevent the effectiveness of vaccine. This can be injected along on the antigen to help the immune system generate the antibodies to fight against the antigen. So this will be muscle relaxation, antidepressant, and anti-epileptic. So here the analgesic leader recommended. So the first step, we are giving paracetamol. Second, paracetamol plus codeine. The third step is considered replacing codeine with NSAID, maintain paracetamol. So step 4, consider replacing codeine with prescription medication. And step 5 is consider replacing with morphine. So analgesic weak opioid use drug codeine combination product, oxycodone combination product. We should not use dextropropoxyphene along with this medicine. So analgesic strong opioid, we use the morphine, hydromorphone, fentanyl, oxycodone, and methadone. So along with morphine, we should not use meperidine, anileperidine, and pentazocine. So opioid side effect, patient mostly if we administer opioid medication, patient will have the constipation, nausea, vomiting, urinary retention, itching or rashes, dry mouth, respiratory distress, neurotoxicity like delirium, and myelinating seizure, so and drug interaction. So that's it, thank you.
Thank you, Fika. I just wanted one comment, Fika. When you describe adjuvant, so adjuvant is a generic term that means something that improves or aids something else. So yeah, you described the adjuvant for the vaccines, which has a specific meaning, but really, I think you meant that there are some drugs and some things that can be done that can improve or help the control of pain, but will not control it by themselves. I think that was the sort of meaning. And I think is in the pain management, yes, it's important to combine things, even pharmacological with non-pharmacological treatment of pain, etc. Anyway, that was very good. Any questions before we move on to the poll?
No, sir.
Okay, so let's do the poll. Maybe I don't know why I don't see it. Oh boy. I don't have the option of the poll. Let me see.